All right, welcome back. We are just having a conversation around the status of alcohol use in the country, and of course even the abuse of drugs and other substances. And we've looked at what the numbers tell us, but now we are hearing it from the horse's mouth. We have with us in studio this morning Anne Matthew, the vice chair of NACADA, and also is a recovering addict who actually has taken us through how, you know, this took a toll on her, and how she even, we would not be having her here today to tell us this story, were it not for the decision she took to regain what she lost and to start her recovery journey. We'll be hearing more about that journey later. But you're also having in studio this morning Boniface Ndirangu, the chair and CEO of Addictions Prevention and Rehabilitation Association of Kenya, and Stanley Kamau, the founder of Ahadi Kenya Trust. And an interesting thing that happened just recently in Murang'a County, Stanley, and I want you to tell me a bit more about that. We saw, you know, after the August 2022 general election, we thought elections were gone. And then people in Murang'a County the other day were sort of like doing their own version of elections, or is it a by-election? But there is something behind this. I want you to tell me a bit more about what inspired this and the crisis that is there in central Kenya when it comes to alcohol and drug use.
One thing I would like to say is that the issue of drug addiction and alcohol can actually not be fought in the boardrooms. We can't sit here and say how we are going to eradicate alcoholism in this country. And if we are not going to involve the affected families and the communities, we are not going to achieve anything in line with fighting alcoholism. What I realized is that every time you go to the village and talk about the people who are selling alcohol, there's a blame game between the chiefs, the police, the community members. They say they report, no one comes to take any action. They identify those people, no one. But when you go to the police, they say there's no evidence about these people who are selling. So I realized it's more important to involve the affected families and let them be the ones to tell us where do their brothers, their sisters, their wives, their husbands buy this alcohol from. Who are these who are spoiling our young people? And that's why I realized that I need to bring in ballot papers, the balloting. Let people come together, let the community come together, let them vote for the persons who are selling alcohol, who are selling bangi, who are selling any other kind of stuff in the village. And by the way, let me tell you.
This is not a good election to win, right?
It's not that one has no rigging. You can't league. Because I can tell you we had more than 300 women, and these are affected families. And you could see from the ballot papers, there are those who are voted by 70 people, 50 people. It's not a coincidence that people can actually identify one person to be selling bangi. 70 people say one person sells bangi, or 50. And then those ballot papers, we did, the media was the observers. Those are the observers. And we had Chebukati, somebody who led the results, although we did not name anybody. These are just suspects. And those ballot papers were actually given, the winners were given to the county commander to take action. But I can tell you, everybody you talk to, they say they know who sells these substances. And again, I like what they are doing at NACADA. But closing bars is not a solution. You cannot fight alcoholism, bangi, and drugs by closing bars. Because one, we don't have shops selling bangi. People still smoke bangi. We don't have shops selling other hard drugs. People still take them. Because what the new style of doing business is door to door. We need to identify who are these distributors, who are the people who are taking drugs to the villages, what are the kind of alcohol and substance of abuse that is being abused by the communities. If we talk about, like now when I go to the village, because I travel all over this country, I can tell you, the NACADA Act, I don't know whether it's an act or whatever it was done by Mutulu, it has not been implemented to date. So when NACADA talks about all these statistics, my question is NACADA toothless? We still have bars near primary schools. We are talking about when NACADA was formed, when Kaguthi was, I think, the coordinator. I was the chairman for Youth Against Drugs. We came up with handbooks, even for telltales. How do you tell that your child is starting to smoke? How do you tell your child is taking alcohol? Today, we are talking about interventions for people already addicted, but we are not putting so much effort in trying prevention and control. And I think this is the challenge NACADA has. The other day I had people say how we should put up rehabilitation centers. Where are we fighting alcohol like the way we fight mosquitoes? Why do we have to buy nets instead of fighting where the mosquitoes breed? Let's look at how we can be able to control, prevent alcoholism, but let's not go to talking about rehabilitation centers. It's like saying when you go to fight bandits in Baringo, instead of eradicating those bandits, we say we are going to put more morgues. I think that's the wrong approach. It's the wrong approach.
All right.
Let's see how we can be able to prevent and control the use of alcohol and drugs in this society. Let's not go for interventions when people are already addicted. Like now, if anybody who smokes, and I can tell you, even in primary school, there's the telltales. One, you always find some substances in their shirt. Have the parents been taught on how to look at these signs? Do they know how, when a child starts drinking, how they behave? We are talking about, and I think we're using a very bad method of scaring people already drinking than actually giving more information on how we can prevent them from alcoholism.
We are reactive.
We are
as
very reactive.
To being proactive. And he's touched a very important point, a sector that you thrive in, addiction prevention and rehabilitation. Tell me a bit about how that is possible. How do we invest more on the proactive approaches to addressing the issue of addiction in our country, from your perspective?
Well, I think that is just very deep. Congratulations. Let me start first by saying that we are really excited to have Anne Matthew as our first person who is in recovery on the board of NACADA. And we want to encourage NACADA to really take up on people who are in recovery among their management, among their employees, because there are quite a number of us. Because way before NACADA was formed, there were groups in this country. I know thousands of people who have helped others quietly through the 12-step programs called Alcoholic Anonymous, Narcotics Anonymous. People who do a lot of quiet good, supporting addicts get recovery. And for us to see Anne Matthew we celebrate her really as an achievement that we think is a way to go. And I'll agree with the last speaker in that sense, because demand reduction is perhaps the best supply suppression strategy. And demand reduction involves just what he innovatively did, highlight who are the people, supplying this in a very innovative manner. Supply suppression, as we know it to this day, has had the effect that we have seen. And it's not just in Kenya. In the US, for 30 years, they have fought the war on drugs. Has been a long-drawn war. In the early 1920s, the US had prohibition laws to disallow alcohol. That is when bootleggers and quite a number of people. So supply suppression as a strategic option, the costs of curtailing supply and legal mechanisms have been known to work very briefly for a short time before the supply meets the demand. Because the demand comes from the bottom. You can pour all the police officers who are genuine, pour the chiefs across the country, make sure that there is no supply. It will find. It's just market forces.
But how do you control supply of something that is the biggest money maker? I'm looking at,
those are the motivations.
Even for the country. Those
are the drivers. The drivers, you see, even Singapore, they have a death penalty for people who are caught trafficking. It hikes up the price so much of that product that it becomes worthwhile to risk your life to get through with 5 kilograms of cocaine to Singapore. There are people who have been caught and said, yeah, I accept the death penalty. I was tempted by the profits. Yeah? So supply suppression has to be also very innovative. You know, there are innovative ways of cutting down the supply. You can educate, like these manufacturers in Central Province. We need to sit them down. We need, and that's the serious perception issue, because we see alcoholism in Central. We haven't seen that much in Western in terms of alcohol, or as compared, or it is in the brewing sector. That is why I say it is interesting to see. Yeah. So Central Province, because of this potable spirits, the high content of the alcohol in it, it's really a poison. It's not 40% alcohol, 70% alcoholic content. It's so strong and potent that the effects are visible from few months of using. We see people who are only 20-something already have developed a problem. So we need to develop the communities, such as he's saying, yeah, to help with the prevention programs. We need to develop, I don't know, there's so many things we could, youth resiliency programs. We need that positive psychology of building our youth. You know what there's a professor who came here recently from Israel, and they are giving us experience on how they do it in Israel. I've been trained in Israel myself. And the programs are positive in nature, in that we look at not just parents, because some parents have a problem themselves. Yeah? Mm-hmm. Majority of the parents who, like we heard from the previous speaker here, is a father who gave the first drink. Yeah? I was a former drug addict myself. First person who ever gave me was a very serious sports person I admired. Mm-hmm. Yeah? Mm-hmm. So the people who influence us can be our own parents, the people who need to protect us, the ones who give us a bad example. Yeah. However, the good thing is this, that we don't need definitely we don't need every parent to be cooperative. We just need one sober adult in an area, one sober, clear-minded person who intervenes and plays the role of a parent. Yeah. Yeah. We need class teachers who give positive experience in the class management. Every school needs a very good class teacher who is able to pick up on the issues with the children. You know, they spend a lot of time in school. Who is able to create a positive experience in school. We just need one teacher in every school, or class teachers who learn how to manage young people, to give them a positive experience in school. We need to create opportunities of self-worth. Now this is positive psychology for our young people. Now, there's no programs being set up. Apart from NACADA recently have started a pilot study on life skills training, and I think they have rolled it out now to 100 schools, primary schools, and the parenting skills.
That has not been the pilot phase of the project. Is it being rolled out soon?
Hopefully, yeah, hopefully. Okay. I would want to have a look at it and see how effective it is, and see what else it is possible we can add. Yeah, but we need to replace, have a way in which we provide alternatives that are more attractive than substance use for the young population between those ages 16 to 24. Are they going for sports? Are there clubs for young people? Are there hikes? Mm-hmm. Interesting debates, you know, clean, fun places to dance and enjoy music. Adult supervision, even when they go out. When they go out, I mean, who supervises these people? I've gone to Westlands a few times, or Ngara sometimes. When I'm driving in late at night, I'm going to pick a client, and I see young people unsupervised with the drunk cops patrolling, and very young people exploring for the first time. These are people who don't have a drinking problem. They're drinking, they're enjoying, they're young, they're having fun. Yeah? But in their lax danger And our communities, and this is where our brother comes in, our communities need to develop patrols, safe patrols. It's not stopping people from drinking. Safe patrols for people who have overdrunk, who have had look like they're puking or need help or directions or need to be supported, just briefly. Yeah, we need intervention.
People who shouldn't be drinking.
Yes.
All right. So,
maybe I can add on to what both my colleagues have said. Actually, the campaign against alcohol and drug abuse is two-pronged. We have the supply suppression and demand reduction. And the moment the demand goes down, the supply definitely will go down. So demand reduction is also two-pronged. We have the preventive and the curative. And like we said, addiction is a brain disease. It is a disorder for the whole person. And that's why we have the preventive and the creative and the curative. So on the preventive side, we're going to do sobriety mashinani.
So this is as NACADA now?
Yeah,
okay.
We are going to do things differently going forward, although these are still structures that are going to be, put in place. And we are going to reach out. We are going to have community-based programs through churches, through communities, through organized women groups, reaching out to that person in the village, giving them the information, because we say, share the facts and save a life. When you share the facts, you say, either you prevent this person from getting into drugs, or if they started, they stop. If they are unable, if they've gotten to the habitual stage and the compulsive stage, this is where rehabilitation will come in. Because remember, the organ that is actually most affected by substance use and abuse is actually the brain. And that's why we have structured treatment programs where we have psychiatrists, we have psychologists, we have counselors, we have peer educators, we have recovery coaches, all that, structured, very well structured. And I said, I always say, this calls for collective responsibility. Like what Dr. Kamau did in Muranga, reaching out to the people, getting information from the people in a very conducive and safe environment. So we'll also reach out to people in barazas, the boda circles, the matatu circles. We bring everybody on board, because addiction cuts across the board. We cannot say it's the rich or the poor. It's everybody. Everybody has to come on board. We'll listen to everybody and then come up with very structured program. Positive parenting has already been rolled out. And what Boniface has said about age-appropriate programs in schools. And there's a time there was this debate of whether a teacher should also be a counselor, or the school should have a counselor who is not a teacher, because definitely a teacher will give a little bit of discipline when the counselor is a little bit compassionate, So having a counselor in school is also very good, would be also add value to this. Because some of these children actually will do drugs because of what they are going through at home. Some of them have been sexually abused by their own parents. Others have been emotionally abused, psychologically abused. So you find a child in school is a total wreck. So when you try and find out where this child is coming from, he's always number last. But where is the problem? The problem is within the family setting. We have Nyumba Kumi. We reach out to those people, give them basic counseling skills, basic addiction prevention strategies. And when we do that, we have recovery coaches. There are people who are out of addiction, who are in recovery, and we always advocate that the person should be at least 3 years sober, so that we make sure this person is emotionally or holistically stable. Train these people, because these people are very passionate, and they will do voluntary work as volunteers. You know why? The 12-step program instructs us to reach out to the alcoholic, the drug addict, and sorry to use that term, but that's what the 12-step program says, who still suffers. So you, as a recovering person who is sober, you have the responsibility to hold the hand of that person who is suffering. I am here because another person held my hand. Not a person who had been trained, not a person who was a professional, but a person who had been through that program, who has been through the pain of addiction, who has the passion to help another, walk into the addiction world, hold your hand and walk out walk you out of the addiction world. So if we can have these people in recovery trained as recovery coaches and then work closely with the county government, their respective county governments and sub-county committees, because we have county committees, we have sub-county committees, they can work closely with these committees.
All right.
And believe you me, we'll be able to do early identification, early intervention.
Early intervention. I want to know your turning point and how it came, but hold that thought. Stanley,
yes.
We're talking a lot about positive parenting.
Yeah.
You engage a lot with the community and some of these affected families. Do you get an understanding, do you see a society that has an understanding of what it means, this positive parenting that you're talking about, and what initiatives have you put in place to instill this in them?
There are many things that we can do to prevent and control the use of alcohol and drug substance abuse. But one of the things I really discourage, it's good they're talking about using the recovered addicts to talk about alcoholism. But sometimes we cause more harm than good. When people who have recovered from alcoholism and drug addiction talks about their journey and their success. Because every young person will ask, why can't you be like her? Why don't you let me drink and smoke? And then I'll become
it was at the verge of death. Would anyone want to go to that?
No. Let me tell you.
I mean, if you hear that, you'd be scared.
Need to be given information very carefully. You don't project a person that I can be like this, and then when I turn 30, my life can change. And then let's also not advertise alcohol and drugs pretending that we are fighting the fights. There are many children who don't know about bangi, but they hear about bangi when we talk about it. And they would want to experience, what is this people are talking about? So my concern is there a way we can be able to educate? And this is a moral obligation. Is there a way we can we can shield our children from accessing this information about what is happening? Is there any way we can be able to put our young people more active in more important things, so that by the time they come to realize that there is something called bangi, there is alcohol, they've already engaged in a more constructive...
But is that even possible in this current society?
It's very possible.
How do you keep them from not knowing that there is something
they can know
called
it's
bangi
there.
or alcohol?
But the more we talk to our children like we are fighting them, don't drink, don't smoke, don't do this, don't do this. We need to educate them in a more sober way, like he has said, in a more sober way, so that they don't look forward to testing that thing they've been told, how it makes someone feel. Like most of the alcohol that we have that is causing this addiction is the one that has a very high alcohol percentage. Why? Because the manufacturers have realized, if I go somewhere to Murang'a or Embu or maybe Busia or Kakamega, the people who are drinking have very limited resources. So what they normally do is they put a very high alcohol content, a content that will make somebody drunk within 2 minutes or 3 minutes, because that to them is business. Because if you have 10 shillings, you can't be in the bar from evening to morning drinking. You just want to get high, and then you go and sleep. Then we have this other category of people who just now, she said about social drinkers, who will drink from 4 p.m. to midnight. They have their blood of alcohol that they actually take, maybe wine or any other kind of a drink. Then we have the extreme ones, who now addicted. They can drink the whole night and never get drunk. So my problem is not about how to eradicate. My problem is, how do we prevent these people from drinking? How do we get information? Like when we were young people, I can tell you, my dad and my uncles or whoever, the community, they never exposed me to alcohol. They never exposed me to cigarettes. Every time I would be sent, even by my uncle, even when I was in high school, to go and buy a cigarette. And I find an elderly person than me, I would not even buy. Because the shopkeeper would ask me, who has sent me. So the community responsibility is no longer with us, because they want to make money. And how do they make money? By using every kind of a customer who can bring in that money. So we need to go back to the communities talk to the community, show them that this problem, if this child becomes an alcoholic, if this child becomes a drug addict, the consequences would be you'll be one of the victims
of that.
Everybody suffers. Everybody suffers.
Okay.
But now what they do is that they look at a family that is drinking, and everybody says that that family has a problem with drinking.
Actually, if you allow me.
Actually looks at that family as a community. They look at that family as something different from the community. So the first thing is we must put all the policies in order. We cannot fight alcohol and drugs without involving the schools, involving the provincial administration, the community, and actually, like she said, volunteers who can be talking about the positive things in life, but not talking about, if everybody goes to the village and talks about alcohol and drugs, I can tell you 10% of those people that day would want to go and get experience. What is this?
So, okay. I'm coming to, allow me, Anne, let me just respond to what he has said, Stanley.
Yes.
And then we'll come.
Yeah, he has raised a few issues. Some I agree with, some I don't. One of the things I agree with is the positive psychology and how we can build on that, and that can be very positive, yeah? Yeah, that I agree with. You see, many people, we really have to sometimes take time out, kidogo, to learn from, because you see, like this research that has been done, it has quite a bit of information for us to learn from. And this community, we are not the first community in this world to go through the crisis we are going through. And we are not the only ones. Almost every country in this world is going through this, these problems. These are shifts from cultural, how we used to be like. Our African culture, our settings, how we used to do things. Then all of a sudden we have a new economic system, money coming into the picture, stress of jobs, divorces, you know, classes. We never used to have this. So this is a serious shift. And with it comes a lot of knowledge, and we need to take time out to learn from experience of others and from the available researches about what works and what doesn't. Yeah? So what works? Yeah? Demand reduction, definitely. But it has to be, as he rightfully puts it, smartly done. Not glorifying addiction, not glorifying the substances. But more focused on most positive things to do, and depending with the age. And then those that are starting to develop problems, we highlight them over time. There's a research called behavior among school-going children that can help, and it's by World Health Organization. Kenya has not signed up for it. I've been pushing that we should sign up for this because it helps us pick up on behaviors, and we can track children from the age of 1, just like we track them with CBC on how they're doing in maths and English and science. We can track their behaviors. And with these indicators, we are able to pick out on people who can become problematic and start brief interventions. These are cost-effective ways of reducing the cost of the burden of addiction. Because as he says, it affects the community in the long run. Do you know, Safin, that actually economies that do almost zero about addiction or have very poor performing, it costs addiction. Addiction costs the economy close to 6% of the GDP. 6%. 6% of the GDP, if you translate it in our Kenyan version, is close to 900 billion. And that is direct cost every year of
this
death.
Is an annual figure.
Yes, annual. These are, and this is countries done. This is research done by most countries around the world. That when we have poor interventions, or no intervention at all, the average cost of addictions across economies is close to about 6% of the GDP. Oh. Now, they have calculated and found that there are certain interventions if put in place which work, yeah, and can be monitored and can be calculated, just like this research. Because in this research by NACADA, if you look at it, and we have the trends from 2007 all the way to 2012, there's a remarkable shift between 4 to 5% of reduction in the prevalence rates, in alcohol, in khat, in marijuana, from 2007 to 2022.
But not cannabis.
But not cannabis. Cannabis is the one that has gone up.
Because of time, allow me also give Anne a chance because I'm running out of time for this. And there are thousands who are watching this morning and they would want that turning point. They are wondering, is it even possible for me to break free from this addiction that I'm going through? Tell me a bit about how you came to that turning point and what has worked for you for, is it 18 years now?
Yeah, 18 years. Yeah, first of all, I'd like to clarify to Dr. Kamau about the recovery coaches. The recovery coaches, like I said, demand reduction still is two-pronged. There's the preventive, and then there's the curative. Recovery coaches are used to reach out to people who are already in addiction. We don't use recovery coaches in schools. Personally, I can't go to school and start giving my story. But at the workplace, we are invited. Because we have people working people who are working and still have a drinking problem. So recovery coaches, it's very clear. It's only for early identification and early intervention, and then they can do an assessment and know where to place that person who is suffering. So for prevention, for preventive measures, we have people who are trained and who reach out to people in schools. And then again, we talked about age-appropriate programs. There are things we can tell a standard 3, and there are things we can tell a form 4. So my turning point was when I actually, like I told you, I attempted suicide 3 times. And actually a person I used to drink with who had been to rehab is the one who reached out and gave me hope and told me, Anne, there is life after addiction. An addict is not a failure. They are only down but not out. With treatment, rehabilitation, psychosocial support, they can spring back to life and become productive members of the society. Let us not look at them as outcasts. This is, we chose to drink, but nobody in the entire world chooses to become a drug addict or chooses to become an alcoholic. And like we said, it is a mental health disorder. It is a brain disease that is progressive, it is chronic.
Thank you.
And
thank you, Anne. Thank you so much. Allow me to wrap it up there. I don't know whether we have a few messages, from our viewers, just to sample as we close this chapter and move on to the next. Remember, we invited you to also comment on what we are discussing this morning. And Honorable Lillian Sioi, illicit alcohol and drugs is rampant in many parts of the country. Central Kenya included. The war on alcohol and drugs should be extended to the whole part of all the parts of the country to save our generations. Thank you. Abu Michael K.E. Getting into drug abuse is so easy, but getting out of it is a total nightmare. What we should avoid is more and more people and youths getting into the use of drugs and substance abuse. The government should solve the equation. And of course, Bob Otieno, we know they need the campaign more about the dangers of alcohol and drug abuse through media and hold public barazas to reach out, especially those from mashinani who don't have TVs or can't reach social media. Thank you, Bob, for that. Samuel Worth, you say NACADA needs to be funded in a manner that it rallies behind drug awareness campaigns. They have done enough publications and civic education. The next step is campaigns that reach out to many people, especially on digital space. Thank you, Samuel. Sir Nixon, you say kindly note the drug abuse activities are carried on within the proximities of the government administrators, e.g. chiefs, county commissioners, wazee wa nyumba kumi, etc. It's like they are the umbrella of the vice. Kupambana na drugs ni ngumu. Okay, those are some of the sentiments you've shared with us at Citizen TV Kenya. So very quickly, a final round of final remarks. Stanley, let me begin with you.
What I'd say is that from what I said from the beginning, if we want to win this war, we must involve the communities. The reason why we should involve the communities, they are the ones who know who is the seller, who is a peddler, who is the distributor, and who is preventing or who is protecting those people. Right. So what I would urge the government, and maybe through NACADA, is like what we did in Murang'a, to duplicate that. You can actually take ballot boxes to all the chief offices in this country and ask the chiefs to do one-day meeting and let people put the names of those suspected peddlers in those ballot boxes in the presence of senior police officers. Like what we did in Murang'a, I can tell you. We have very committed, like county commander in Murang'a. We have very committed county commissioner in Murang'a. We have very committed political leaders in Murang'a. So we need all the leaders, from political leaders, provincial administration, and each and every other person, and the community to be committed to the fight against drugs and alcohol. Otherwise, if we discuss things, come with statistics, do them in boardrooms, I can tell you, we'll talk about alcohol and drugs for the next 50 years.
Okay, and just a parting shot.
There is a way out, there is a solution, there is hope, sobriety mashinani. That's where we are going.
Thank you. And Boniface?
Recovery works, yeah. Recovery works. Rehabilitation really does work. I represent over 200 rehab centers in Kenya that have helped quite a number of people, despite the relapse rates. The best way to go, as Dr. mentions, is developing community-based rehabilitation centers, community-based, that outpatient and low cost, because we have about 1.3 million people who we have been told are now addicted to alcohol. So the work is with NACADA. They have a big role to play. They should involve the Ministry of Health with regard to treatment. They should involve the Ministry of ICT in regard to developing nuanced new ways of communicating through the internet to reduce the new demand spaces that are coming up, and supply suppression strategies through the internet. Online distribution has become quite a bit in Nairobi. And devolve. NACADA should just really get devolved into the ministries, into county governments, and pass on that message that is informed on what works and what doesn't.
Thank you so much, Boniface and Ndiragu, the Chair and CEO, Addictions Prevention and Rehabilitation Association of Kenya. We are also having a sit down with Stanley Kamau, the founder, Ahadi Kenya Trust, and Anne Mathu, the Vice Chair of NACADA. Thank you, ladies and gentlemen, for creating time. Of course, a conversation that we cannot conclude in one sitting, but I hope you know now that you have a responsibility, something you need to do. If you're not affected because you're an addict, then that addiction will somehow affect you in one way or the other. Call out those who sell the alcohol and drugs in our society and do something to help those who are sick. I mean, those who are addicted to get treatment and to restore their lives. We are coming up with the next conversation on just focusing on changing lives and impacting communities still, but in a different aspect. I'll be having a sit down shortly with Karen Basie, the Director, Sustainable Business and Social Impact from Safaricom, and she will be telling us a bit about their journey and what they've been able to do to touch lives within the communities that they operate in just a bit. Do stay with us for that and much more. This is Daybreak.